All right, so if you're in public health, you know the real goal isn't just to understand a problem, it's to actually create change. But how do you do that? How do you get from a huge, complex issue to a campaign that actually makes a difference? Well, that's exactly what we're going to tackle today. We're going to build that bridge from theory to action, using smoking cessation as our main example, to give you a hands-on guide for your own work.
Think about it. We can put massive warnings on cigarette packs. We can list all the scary statistics. We can tell people the risks until we're blue in the face. But knowing something is bad for you, that's a completely different thing from actually changing what you do every day. And that is the real challenge in public health today. It's not just about giving people information. It's about understanding the deep, complex reasons behind our choices.
So here's our game plan. First, we'll look at the big picture, what the modern public health landscape looks like. Then, we'll dive into some essential frameworks that are going to be your best friends for understanding behavior. After that, we'll see how it all works in the real world with a fascinating case study on smoking. Then, we'll connect those insights to practical tools. And finally, we'll wrap it all up with a clear, 5-step blueprint you can use to design your own campaign.
Okay, first things first. Let's set the stage. The entire field of public health has gone through this huge shift, and getting a handle on this new landscape is absolutely crucial for making an impact. You know, if you go back 100 years or so, the biggest threats were communicable diseases, things you could catch like the flu or tuberculosis. But today, at least in developed countries, the battlefield has totally changed. Now, we're mainly fighting chronic, non-communicable diseases. We're talking about those long-term conditions like heart disease, diabetes, and many cancers that develop over a person's lifetime. And what's fueling these chronic diseases? Well, for the most part, it's us. It's our lifestyles. The behaviors you see here are the root causes of so many of today's biggest health crises. And that's why behavior change isn't just part of public health anymore. It is right at the very heart of it. So if behavior is the target, where do we even begin to understand it? It can feel overwhelming, right? Well, what we need is a blueprint. And luckily, public health gives us some really powerful frameworks to guide our thinking.
This right here is the Dahlgren and Whitehead model. It's such a great tool for seeing the whole picture. Think of it like a set of rings, one inside the other. Right at the core, you have individual stuff like your age and genetics, but then you move out and you see our lifestyle choices are influenced by our friends and family, which are then shaped by where we live and work, and all of that is wrapped up in these huge societal and economic factors. It just shows that health isn't just about one person's choice. It's shaped by every single one of these layers.
Okay, let's make this real. Let's think about smoking. Where would you put different things on this map? Peer pressure? Yeah, that probably sits in social and community networks. What about the price of cigarettes or advertising bans? That's way out in the big socio-economic layer. Your job or your income? That's right there in living and working conditions. You see how just one behavior is touched by this entire system.
So while that first model helps us map the whole system, we also need a tool to zoom in and diagnose what's happening on an individual level. And for that, we have the COM-B model. It's so simple, but incredibly useful for figuring out what's really going on.
COM basically tells us that for any behavior to happen, 3 things have to be in place. First, a person needs the capability. Do they have the skills, both physical and psychological, to do it? Second, they need the opportunity. Does their environment, both social and physical, actually allow it? And third, they need the motivation. Do they really want to do it more than they want to do other things? If even one of these is missing, the behavior just isn't going to happen. So if we want to change a behavior, we need to figure out which of these we need to work on.
These models are our maps, but to truly understand a community, we need more. We need a magnifying glass. We have to go beyond the theory and see how these big ideas actually play out in people's messy, complicated, real lives. And that's where research comes in. Now check out this quote. It's from a qualitative study, so research that's all about understanding people's experiences through things like interviews, not just crunching numbers. And this finding, it just completely reframes the whole problem. It's saying that for some mothers, the decision to smoke isn't really a health decision at all. It's all tangled up in the day-to-day practical reality of their lives.
This insight came from a 2007 study by Robinson and Kirkcaldy. What they did was they held focus groups with 54 mothers in disadvantaged communities. They just wanted to talk, to listen, and to really understand their world and why they made the decisions they did about smoking at home.
And what they found was kind of incredible. They discovered this huge gap between the official public health advice and what people were actually doing. A mother might know all about secondhand smoke, sure,
But her idea of smoking outside might just be stepping into the kitchen or cracking open a door, because the practical need to keep an eye on her kids was way more immediate and urgent than some abstract health risk.
The research also revealed that social rituals, like having a cigarette with a friend who pops over, were incredibly powerful forces. The fear of making things awkward or disrupting those relationships was often a much bigger deal than the health advice they'd heard. For them, health warnings were just guidelines, something to be adapted to fit their social reality, not strict rules to live by.
And this is why that kind of deep, human research is so important. It gives us the why behind the what. Once we have those insights, then we can open up our toolbox and start picking the right tools for the job.
So on one side, you have this intensely personal, daily cycle of addiction. And on the other, you have this huge, multi-layered, system-wide response that's needed to support that one person. Any effective strategy has to work on both of those levels at the same time.
This big, coordinated strategy has a name. It's called tobacco control. And it's not just one thing. It's a whole field of science and policy and practice. It's everything from taxes and laws to local stop smoking services and massive awareness campaigns. And within that big strategy are these beautifully simple, effective tools, like the 3 A's. It's a really quick intervention that any health professional can use. Ask, advise, and act. But here's the magic part. The kind of research we just looked at completely transforms that advise step. Instead of just saying, you should quit, you can have a real conversation, one that's informed by a genuine understanding of a person's life, their barriers, and what kind of support they actually need.
So, we've looked at the landscape, the frameworks, the research, and the tools. Now, it's your turn. Let's put all of this together into a clear process for designing a campaign that really works. Here it is, your 5-step blueprint. Step 1. Map the problem. Use a big picture framework like Dahlgren and Whitehead to see all the different forces at play. Step 2. Research your audience. Go out and find their reality, just like in the case study. Step 3. Diagnose their barriers, using COM-B. Is it about capability, opportunity, or motivation? Step 4. Design your intervention. Make sure it is laser-focused on addressing the specific barriers you just found. And finally, Step 5. Figure out how you're going to measure success. You have to plan for that right from the very beginning.
Effective public health isn't really about having all the answers. It's about asking the right questions and then really listening to the answers. You have the models and the methods to guide you. So the real question is, what human truth are you going to uncover to make your campaign connect and ultimately make a real difference?